I was taught that after the inflatable penile prosthesis, it is safe to say that your penis will get shortened about an inch at maximum, like 2.4 centimeters or something like that. And I was trying to tell my patients that, and they said, "Why?" I don't know. Your penis get erected, and the shortening is inevitable. That's what you have to live with. But me myself, who was talking that story to my patients, was not able to accept it. What if I getting a penile implant and I have to lose my length? 2 centimeter in the height wise, it is not a big deal. But in here, no, I don't want that. So that's the reason why I started to think more about the size, how to get it, restored. What I'm saying is not strictly, not all the physicians will agree with me. And my own results it shows different results than the others. There's a blooming theories about that we do not shorten the penis after the surgery, but actually my papers and my research shows that we restore the size. Penis will shrink if they have erectile dysfunction. The size and the function, I'll say in my eyes, they go the same way. The lower the function, the smaller the size. It will be that way. Then, the purpose of this treatment is for the patient satisfaction, which means that size is important. Every man, we know that our size is important. So, I believe the goal of the treatment and the way we should do the surgery should be able to meet the needs of the patient. That's why I focus on the size. I try to give them the best size ever, what they can have. After all, size matters, right?